Okay, I'll take it. I move that the items on the meeting agenda constitute essential business of this board. Meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans considering the COVID-19 outbreak and any conflicting with the governor's executive order permitting electronic meetings to be suspended.
Seconded.
Thank you. Any discussion? All right. Dr. Smith.
Aye.
Dr. Campbell.
Aye.
Ms. Etherington.
Yes, aye.
And I as well.
And I am here as well, Alex. David Frederick.
Oh, great. David's here. Great.
Hey.
Thank you. All right. Consideration of extension of public health emergency. The current public health emergency goes until March, April, end of May, right, Tom Sharp? Yep. If you all remember, we have been extending it 1 month at a time to give a 3-month lead time, which I believe all entities who've been impacted by it believe has worked more smoothly than where we had been. So I would welcome if anyone would like to discuss and or an extension by 1 more month till the end of June.
So moved. I move to extend our emergency to the end of June 30th.
Thank you, Mr. Frederick. Is there a second around this?
Seconded.
Any other discussion? All right, Mr. Smith, or Dr. Smith, excuse me.
It's all good.
Mr. Frederick, sorry, I'm having a moment here. Mr. Frederick, there you go. Thank you. Ms. Etherington.
Aye.
Dr. Campbell.
Aye.
I also aye. All right, thank you. February 11th minutes were circulated in our packet. Anyone have a chance to review and have any corrections or discussion around them?
I would move approval of the minutes as distributed.
Thank you, Mr. Frederick. Is there a second?
Second.
All right, I heard Ms. Etherington. Okay, thank you. Dr. Smith?
Aye.
Dr. Campbell?
Aye.
Ms. Etherington?
Aye.
Mr. Franklin?
How about
Mr. Frederick?
Alex, do you need to go to bed? Bless your heart.
I mean, it's embarrassing. I'm sorry. So, Mr. Frederick, is that an aye?
That is.
And I also aye. There we go. Thank you. Apparently I do, Harold. I didn't think it was this bad off. Okay. Thank you. I noted, we're going to delay our ethics presentation this month so that the entire board can join us. Ms. Franklin should hopefully be available next month. And so I appreciate you guys understanding that. And Mr. Smith, I'm sorry, we're going to have to delay you by a month, but we can't wait. So thank you.
Yeah, and we'll be able to present it in a more polished fashion.
Okay. So Martha, would you please, one of the board asked, please move that to the next month. Thank you. All right, tobacco resolution. I'm going to let Tom speak to this, but it is a really unique thing that we typically have not done for with this board, and I would like Mr. Sharp to fill us in on what we're going to potentially resolve.
Thank you, Mr. Chairman. So the bill that is pending in the legislature has been in the works for some years now. The driving force behind it are the musicians. The way they couch their argument, their pitch is that they're the last unprotected workers from secondhand smoke. They play in bars that are often, I gather, very smoky, and so they have pulled together a coalition of folks from around the state and the country that are favor limiting exposure to secondhand smoke. The resolution you'll see is short and sweet, and I couched it largely around the issue of preemption as a matter of principle. That while the board would support, it does support this law, which would allow by ordinance or resolution. So the board cannot unilaterally restrict smoking in, this would actually allow us to restrict smoking in 21 and up establishments. It would allow Metro to do that, but the board cannot do it. It would require action by the Metro Council. But framed around the idea that any allowance of more local, nuanced and specified local control of one of the major health hazards in the community is a welcome change at the legislative level. So I'm welcome to answer any questions anybody has.
Thanks. And I will say, Representative Whitson and Senator Briggs, who's a physician, I appreciate their leadership in bringing this up. Anyway, I think as chair, I'll say I think this is a great step to help protect, give more local control, but also to help protect certain members of our population. And so I'm supportive of this, but I welcome any discussion, please.
And I would just add, excuse me, Mr. Chairman, I would just add that particularly as it is framed by the most of the supporters as a way to protect performers, that would be a particularly acute issue, one would think, in Nashville.
Mm-hmm. Any discussion, questions?
Yes, I do have a question, Tom. I guess I should be familiar with it, but do the bars and some of the restaurants that have music, they don't restrict smoking at this point inside the bars?
The Non-Smoker Protection Act allows an establishment to declare itself a 21 and up at all times establishment, in which case they can smoke. And so you can't toggle back and forth legally, at least, and say, well, until 7 o'clock, we are open to all comers. And after that, we're going to close. But if a bar declares itself a 21 and up establishment, you have to be that old to enter, then they can allow smoking if they wish.
Many, even presently, many bars that are over 21 do not allow it.
Okay, I was just really surprised. I'm delighted, and I think you worded this extremely well, Tom. Thank you.
Thank you.
Any other discussion?
Clear. This goes from us, if we approve this, to council.
No, ma'am. This would be a resolution of the board in support of this bill. And frankly, one of the reasons I wanted to talk to the supporters was to see if this would be helpful or harmful. If it was seen as a Nashville-centric driven thing, it might well not play as well. But he is of the belief that they have a broad enough coalition from all across the state that we would just be a part of the mix.
Yeah, we would just be, and it's not typical, Tom, if I can just, for the group, it is not typical, nor do I, when I'm, during my chairship, wanted to become a routine where we necessarily support or not support legislation that's going through the state legislature. But I think this is one that is so germane to what we do as a public health department, as a public health board. That's why Tom and I, in our initial conversations, felt like a support of this, a resolution supporting it, which would just probably become part of whatever record that of many organizations that support this legislation is why we brought it up. But it holds nothing more than say the National Board of Health supports HB 1278 and SB 1024 as written.
That's correct.
Anything else? Anyone? Would anyone want to make a motion to approve this as written or not?
Motion to approve as written.
Thank you, Dr. Smith. Is there a second?
Second.
Carol, okay. Dr. Smith?
Aye.
Aye. Dr. Campbell?
Aye.
Ms. Etherington?
Aye.
Mr. Frederick?
Aye.
Aye, also aye. Okay, thank you.
Thank you, members.
My pleasure. Sorry, let me get back to my menu here. Sorry, Carol, I think you may be right. I'm a little slow right now. Let me figure this. Here we go. Grants and applications, as well as grants and contracts. Mr. Diamond.
Yes, Dr. Jahangir, we do have one application in the packet for the first time in several months. We are requesting approval to apply to the CDC for another public health associate. This would be for our strategic planning and performance evaluation program. So if there's any discussion, we would ask for a motion to approve.
Any discussion?
Motion to approve.
Dr. Smith, motion. Is there a second or is there another discussion?
Second.
Thank you, Carol. Any other discussion? All right, Dr. Smith.
Aye, I'm sorry, I'm having problems too, Alex.
Dr. Campbell.
Aye.
Ms. Etherington.
Aye.
Mr. Frederick.
Aye.
I also, it's where my screen key, I get different, everything moves. All right, that carries. Thank you. Mr. Diamond, next thing.
Yes, Dr. Jahangir, we have 9 grants and contracts for approval. 4 came in the advanced packet, and there are 5 more added today. First one is an addition of $23,000 to the high impact substance abuse grant from the state. Item number 2 was a $2,500 donation from the Friends of Mac for emergency medical care. Item number 3 is a grant from NICO to study the STD HIV fast track clinic. Item number 4 is an addition of the end date of the Public Health Emergency Preparedness Grant. Item number 5 was added. It was an agreement between MAC and an organization called Home to Home for promotional opportunities and keeping animals out of the shelters. And items 6 through 9 were the community partnership fund grants that were previously approved. With the extension of the CARES Act funding, there's no additional funding in place. We just asking the board to reapprove these with the new expiration date of June 30. So I'm happy to entertain any questions on any of those, or would ask for a motion to approve.
I have a question on number 1. I think this is the one that was just added, but it says adds additional funds in hope of increasing the program's impact. Do you know, is that bringing on another individual, or is that changing a program? I mean, that's just a little more general than we usually see in the grants.
Yeah, I would have to pull that. I don't know if Dr. Harris is on, if she could speak directly to it. It's not enough to add another person in whole, but it's a fairly large grant as well.
Okay, well, I'll ask them individually. It just kind of caught my eye because it's such a general statement.
Okay. It's a very large grant, and so 23,000 isn't a tremendous amount, but I can work to get that answer for you.
This is, I assume that you mean that this is an amendment to a larger grant, because this amount is only 23,000.
That's correct. That's the amendment amount.
All right, got it.
Any other discussion?
I would move approval.
Mr. Frederick made a motion to approve. Is that right?
Right.
Okay, sorry. Is there a second?
Second.
All right, Dr. Smith, any other discussion? All right, Dr. Smith.
Aye.
I mean, literally everyone jumps around the screen. It's weird. Ms. Etherington.
Aye.
Okay, Mr. Frederick.
Aye.
Dr. Campbell.
Aye.
I also aye. Thank you. Ms. Lester and Dr. Wright.
Tina, go ahead.
Okay, good afternoon, everyone. I don't want to take Dr. Wright's thunder or Rachel. Actually, I should probably let Rachel talk about the mass clinic since she's on and we can see her. And Rachel came back this month and we are glad for her, glad for it. So if you want to take it away, Rachel, just give them a little brief update on what the Mass Clinic will be about.
Sure. Thank you, Tina. Hi, everybody. It's good to see everybody again. So last week, Tuesday to be exact, we agreed with the state to take about 13,000 of their Johnson & Johnson one-dose vaccine and do a mass vaccination event and hopefully give out about 10,000 of those in one day. So that's going to take place next Saturday, March 20th at Nissan Stadium. It is a drive-through vaccination clinic. We're going to have 20 lanes in the east parking lot. We've got hundreds of volunteers, our Metro partners, our Nissan Stadium partners. Everything we've needed, we've gotten. There's probably about 40 different conversations happening right now from various aspects, but everything is chugging along. It's been a really neat experience, and knock on wood, we have not hit any real roadblocks. So obviously, we'll see how it goes. Everything we're putting into place is to focus on safety and quickly getting folks vaccinated. So the way it breaks down, in 12 hours of vaccinating, if we can vaccinate about 208 people every 15 minutes, we will have 10,000 by the end of the day. That looks like 7 cars per lane every 10 minutes. And the way we have it set up, that is doable. We know there will be some hiccups, some hangups that slow the process down, but overall, we think that it should be a very smooth process. We're busy right now putting together volunteer packets. Our hope is to get our volunteers assigned to a job and familiar with their job before they even show up next Saturday, because that'll take care of a lot of headache for us, that we're not trying to tell people what to do at 5 a.m. So that's our focus right now. Any questions? I could go on and on, but I want the main questions answered, and any details y'all might want to know.
Rachel, how is the sign-up going? Is that an ongoing process? I assume that has opened for the public to register.
So actually, David, it's not open to the public yet for non-medical volunteers, because we have so many organizations, Belmont, Vanderbilt School of Nursing, Ascension, FEMA, we've got the U.S. Forest Service that are here on deployment to help us. We're not quite sure how many non-medical and medical volunteers we're still needing. So when we're going to have that number by early tomorrow morning, and we're working with Hands on Nashville all the time, then they're going to release that sign up. We just didn't want to put it out there and have too many and have to turn people away. We want an expectation for the public.
Okay, thank you.
Okay, great. Thank you, Rachel.
Thanks.
Most of what I had to say is already in the notes, but I didn't put in there about the health equity position. We are moving forward with that. We're going to get that posting up this month. I've been kind of talking with our HR director and with one of the board members, and I think we have a clear idea, I think, of what we want this person to do. So we'll probably within the next couple of weeks get that posting up and start the process. And let's see, didn't make the board packet because it just happened, but we have had a resignation from our Ryan White Part A director. And so he will, his position will, he will end his time with us in April the 2nd, and we will be looking for another director very soon. He has a good staff, and I'm sure they will carry on the work of the Ryan White grant, but it was just renewed March the 1st. So it'll give us an opportunity to really kind of focus on what this new grant year will be for Ryan White. So just wanted to let you all know that. And I think that's all I have besides what's in the packet. If you have any questions, I'll be glad to answer. Okay, Dr. Wright.
I don't have a lot to add to what's in the packet, but I would like to just give you a couple little pieces of information about the vaccine process. Currently, Music City Center is seeing about 1,000 people a day for new vaccines, and starting tomorrow, we'll increase that to 1,500 a day, new vaccine doses. Plus, then they'll have follow-up doses. We are in 1C, and we continue to do 65 and older. Yesterday, for the first time, Davidson County gave over 4,000 doses or vaccinations yesterday, and Music City Center did about a fourth of those. The one other thing I would mention is looking at our 65 and older group, 59% of those people that are in that group have at least received their first vaccination dose, and a breakdown of those eligible in by race and ethnicity. 51% of whites have received their first dose, 41% of blacks, and 50% of Hispanics have received. So not quite where we'd like it yet, but I think we are reaching our minorities a lot better than we thought we would initially. We continue to work with outreach partners, mosques, churches, community-based organizations to go out and take our mobile team out and vaccinate in our underserved areas. And we'll continue to do that. And those are kind of the highlights that I wanted to touch on. Any questions for me?
Dr. Wright, you partially answered a question that I had prepared. One of the things that was asked of me is about the plan to reach those that are shut in, those that don't have good transportation. And I think the mobile access is a big part of that, but could you speak a little bit more to that plan?
Sure. So I've actually been in touch with Dr. Wu from TennCare. We've had discussions around TennCare patients. Now that we're starting to receive Johnson & Johnson vaccine, that seems like the perfect vaccine for those that are homebound to receive. It should be easy for the visiting nurses that are probably already coming into the home to be able to bring out with them, give the vaccine, and a 1-dose shot. They don't have to, that's a very intense, labor-intensive process to get those people. The best thing we can do is get those people around them vaccinated and continue to do that to protect it from being brought into the home.
That's excellent. Thanks so much.
Sure.
Can one of you say a little bit more about this trauma training for the sheriff's office? Which sounds like a great program. I don't remember hearing about it before.
That would be about a year and a half ago. Region 4 came in and did trauma training here at the health department and included a number of our departments across the metro. And several of those people, it was a train the trainer. Several of those people were trained, and the sheriff's office is now implementing that training within DCSO. So they are slowly going through that training process within DCSO for their staff and hoping to change their culture and such. So I know that Rebecca Allison and from my normal duty has been monitoring it. She's not leading it by any means, but I know that it is ongoing. And I think you are right. It should be a very good thing to have that training.
Yeah. Do you know if what groups? Is it by choice or is it kind of?
No, they're pretty much making everybody take it.
Okay, so it is mandated to
yeah.
do that.
Yes.
Terrific. Thank you.
Any other discussion?
Oh, I have one question. Alex sort of asked me to kind of follow up on the privacy issue. And Tina, I had noticed when the last update from Rand, the database is being heavily used by the emergency response people, the appropriate people to be concerned, but there are essentially no inquiries from the police department, and none at all in the month of February. And I'm just curious about the absence of the police using the database. Are they being very avoidant of doing that, or is there some story behind that?
Rand didn't share that with us. He just gave us this little blurb in the paper. But if we put that in the request, I'll be sure and ask him to investigate that more for us, and then make sure we get it out to you.
Great.
But he just sent this just that little bit on it, and so he didn't give us any explanation. And I don't see him on the call right now. So, but I'll follow up on that one for you.
I suspect it's a little bit to do with the overall feeling within the community that there's not a lot of the virus out right now, and a lot of those police officers have been vaccinated, so they just may not be as uncomfortable or concerned as they were. But
okay,
we can definitely have Rand talk to it.
Okay.
Jim, did you want to update Carol?
Yes, Dr. Jahangir, in response to Carol's question about the additional funds, all of that funding, additional funding that was in the amendment goes to the mental health cooperative. So I just checked the budget on that. So there's no additional people, but it is going to the cooperative.
David, did you have a question earlier when your camera was on? It looked like you had your hand up.
I did not, and I was giving feedback, which is the reason I've got my system off now. I'm good.
Okay. Anything else regarding the directors? All right. Hearing none, I will move to my part of the report. I have to also just commend the efforts of the department. First, Ms. Lester. I mean, there's so much. I spoke to someone. I was in the department for a few hours today, and unbeknownst to the leadership here, I walked and talked to a couple of people, and everyone it's just a different vibe, and I'm grateful. And so it's really is the leadership involvement of everyone on this call and beyond. So thank you, Tina and Gil. Thank you both. And then when it comes to the world that I spend more time focused on recently, COVID, I think that's also really critical. I mean, if you look, now over 17% of our city has had at least one shot dose, and that speed is going up. And to say we threw Rachel back fast when she came back is an understatement. So thank you, Rachel, for what you've done. The one thing I do want to mention is I had a phone call this morning with Miss Dia Cirillo. Ms. Cirillo has joined the mayor's office as a senior policy advisor, where she serves as the liaison to the Board of Health and covers issues also related to behavioral health and a few others. And if you remember in the past, we've had a few individuals from the mayor's office, Kristen Zach and Judith Bird, were the two most recent people I'm aware who served in a similar role. Although I think this may be a little different. Ms. Cirillo has an extensive history of policy work, both at the city level. She actually worked, or does still work, as a coordinator of community mental health systems improvement in the behavioral health and wellness councils here through Metropolitan Health. Before that, I mean, she has experience the Illinois governor's office, the city of Chicago, just extensive policy experience. So I tell you all that to say, again, our first conversation was this morning, and she will be serving as kind of the liaison from the mayor's office to the board for essentially everything non-COVID. She asked me to make this quick introduction because I've asked her to reach out to each of you fellow board members, so you can speak with her, get to know her, find out what her thoughts are, and also more important for her, frankly, is to find out what you guys are thinking. And we'll see how this evolves. And I was very grateful to meet her today. She seems very impressive and seems really excited to partner with us. So I just want to make you guys aware in case you get reached out by Ms. Cirillo. Short of that, I don't have much else per se. If anyone have any questions of me, maybe I should open the floor there. This would be a good time. Okay, I'm good with that too. But it is, I do feel like things are from the COVID world going better, and in the department world. I'm excited about the health equity position finally moving forward. So thank you for doing that. All right, board requests then were for me to move the ethics meeting to next month. And then Gino is going to follow up on, I've already forgotten, on one topic. I don't know if Martha is on or around. Is there anything else that you need from us, Martha?
I just want, right? I don't know, I was going to ask another question. I'm looking at David right now, and I'm wondering, are we sending anybody to Albo this year, or is this a year we need to bounce? Because I think it's your turn to go. And I also think that the early bird thing is wearing down. So I didn't know if you wanted to go, or Alex, if you'd had any thought about that, but that's how it was going to, a year ago, that's how it was going to evolve, is that David would be the next board member to go to Nalbo.
I'm supportive of that. I've just, what is it going on this year, and where is it? No.
I'm sorry?
Yeah, if it is going, it's being held this year?
It is, and I don't know whether it's virtual or whatever, but I still get the notices, and if somebody wants to go, and David particularly, since you haven't been, you might want to tell Martha that and get that ball rolling.
I'll give Martha a look into it and see what the timing is.
Yeah,
I would like to.
And if David, if you cannot, I don't know. I think Dr. Campbell has been. I don't know if Dr. Smith has interest or Ms. Franklin.
I think
I'm not very familiar with it.
I went to Denver last year, and we were
2 years ago, maybe it was even by now.
whatever, and so I don't know whether we have the funds. Jim would have to tell that to. We decided it was better to have one person go each year, I think, in the discussion last year. But if it's virtual, that's a whole different ballgame. So.
Sure. Metro does have a non-essential travel freeze in place for all employees. So, I don't know if or when that will be lifted. We certainly could pay for the membership or the conference fee for a virtual meeting, but I don't believe we could allow travel while the current freeze is in place.
Okay. All right. Well, we'll Martha or somebody find out. We'll go from there. Thanks for making up, Carol.
Just for clarity, what is this event again? I'm sorry, guys.
So this is a national organization for boards of health.
Okay.
And so every year we try to send a board member to become acquainted with the organization, hopefully learn something, report back to us, and make us better.
Gotcha.
Okay. Anything else? All right, I'm going to adjourn the Board of Health meeting and open the Civil Service Board meeting. So request for extension out of pay, Mr. Diamond.
Yes, Dr. Jahangir. Holly Rice has been serving in the role of finance manager since Diane Harden's retirement, and her 100th day in that role would be March 31st. So Civil Service Rule 4.10 requires board approval for anything over 100 days in and out of class role. We just did receive a freeze release from downtown finance for that position. So we will be posting it soon and filling it, but it will not be filled before March 31st. So I'd entertain some discussion on that. If not, I would request a motion for approval.
And I'd motion to approve it, but I prefer not to make the motion. So anyone else want to motion?
Approval.
Thank you, Mr. Frederick.
Seconded.
All right, Mr. Dr. Smith. Any further discussion? All right, Dr. Smith.
Aye.
Ms. Etherington.
Aye.
Mr. Frederick.
Aye.
Dr. Campbell.
Aye.
Okay, I also approve. All right, personnel changes.
Yes, the February changes were in your packet. I'm happy to entertain any questions, but we do not need a vote on this.
Okay. And then okay, that's fine. And then what's the plan, Tina, I know this may be fresh, but with the Ryan White director position, is that something that it's going to be posted? Like how's this process go?
Yes, his last day is April the 2nd. We have to wait till he's off of payroll and ask for a freeze release, and then we can post it. And since he's only been in the position about a couple of years, we still have the old posting that we can kind of dust off and make it a little bit more appropriate for this time season. So it'll probably come up sometime late April once he's off of payroll.
Okay, but we're in a good place though with that program in spite of him leaving.
Right. Yeah, we have good staff in that. Oh, okay.
That's good. Thank you. It's an important program. Make sure. Anything else? Hearing none, I will adjourn. Thank you all.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.